Hi, everybody. Welcome to Dr. Misha's podcast. Today we have a little bit of a sensitive subject. So I'm going to, before introducing Dr. Vyshedskiy right away, I'm going to give a little bit of a spiel here. So a lot of my patients, actually myself included, and a lot of our friends and family are afraid of developing a cognitive impairment as we get older. And we're afraid for a good reason. At least 15% of people over age of 65 will develop Alzheimer's disease or some kind of dementia in their lifetime. And actually that number goes up to over 30% by age of 80, 85. So it's a pretty devastating condition to gradually lose one's cognitive capacity. I personally, it's probably for me, it's one of the most feared, I don't know, aging, if you will, or it's not really aging associated, but it's higher risk at aging. And so I've been personally very aggressive at keeping an eye on my own risk factors. And of course, if you've been following me for a while, you know that that's also my passion in my career. So what I thought we're going to do today, I asked Dr. Dr. Vyshedskiy, who's a faculty at Boston University, to come and talk to us about ways we can early diagnose cognitive impairment, and also some of the new tools that he has developed with his team as to how patients can and how all of us can be engaging early on at getting sorted out. Do we have a problem? Do we not have a problem? So Andre, I think with that, let's jump right in. Before we go to the tools you've developed, talk a little bit about sort of what's currently out there on the market. I know there are a lot of tools, and just how do you see this niche, and sort of what do the people generally do, whether they're going straight to a doctor and getting assessed or not?
Right. Well, hello, everybody. I'm Dr. Vyshedskiy. I teach at Boston University, and we conduct research in Alzheimer's disease, where we have developed an intervention, and we have also developed a diagnostic tool that we will talk about in this conversation with Dr. Coben. At this point, if you are afraid that you have a cognitive impairment issue, the only way for you to proceed is to go to your doctor and ask your doctor to administer a test. Usually the doctor would administer BOCA test, Montreal Cognitive Assessment. It's a one-page test, and it's a great test. The only problem with MOCA is that you can take it maybe once or twice a year, because MOCA has only 3 versions. Yes, 3 versions, that's it. So if you have taken version 1, version 2, and version 3, if you want to take additional MOCA, you have to go to version 1, which is, which you might just remember answers. And as a result, MOCA doesn't allow you to track your cognition often. And
well, and also there's a problem. You got to go to a doctor if you want to do it more often. Every time you got to go to someone who can administer the MOCA, right?
Absolutely. So we have developed a different test called Boston Cognitive Assessment. And that test you can take as often as every day if you want. You don't need to go to a doctor. You can take it at home. You can take it on your computer or a smartphone. It's a comprehensive test that has 8 domains, including memory and executive functions. And it provides you a number from 0 to 30 that is reflecting your cognitive abilities at this moment. And by monitoring the score, you can see where you're going, whether you're improving or getting worse. And you can try different interventions and see if your score is improving. It's a very simple, very straightforward test. Every domain has a training session so that you train in that particular type of question. And once you are comfortable with the question, each question will get slightly more difficult to test your level, to test your best level of ability. In the end, you get a score, you see the score. The score is also emailed to you along with every domain score. And you also see the graph over time of how your score is changing.
And you can take this test, every month if you wish, right? I mean, there's no reason to do this test every 6 months as you would do if you go to a doctor.
Correct. We actually recommend once a week. Once a week,
Wow.
you kind of get into routine, and on a certain day of the week, at a certain time, we recommend the same day of the week and the same time. You come to your computer or do it on the phone and go through the test. It takes 10 minutes. And in the end, you have a score and you can see your longitudinal change.
Andrew, and your team recently published a paper on this, basically comparing BOCA and MOCA and saying that they're relatively comparable tests. Can you tell our listeners a little bit about the results of the study?
Yes, it was one of the longest studies of mine. It took us 4 years. It was a very comprehensive study. We have compared patients with cognitive impairment, both Alzheimer's disease and mild cognitive impairment, with controls, age matched and education matched. And we have found that BOCA shows a clear, statistically significant difference between patients and control. We have also demonstrated that the psychometric properties of BOCA are excellent. We have seen that there is no practice effect, which is very important.
Yeah, it's very important.
Coming back to MOCA, MOCA has significant practice effect.
Right.
You take it once, you already learn the questions, and
that's actually been a huge problem for studies. And that's why if you carefully look at the research, in a lot of studies, if you're only using MOCA, there's a critique because there's a concern that you can entrain the patient to do the better. And then so it's not really an effect of the thing you're studying, but it's an effective person doing more and more tests. And so that's been critical. And but if you look at the research, the other complex tools used in the research, not used in clinical practice. So when you compare those studies that do not use MOCA at all, but use other more complex tests, then it's kind of hard to figure out whether you can apply that study to the patient in front of you. So, this tool to me is kind of solves both of these issues. Now, hopefully in the future, more and more places will start using BOCA, not just for clinical, but also for research.
Correct. So the magic of BOCA is that we use random, non-repeating questions. So every time you take the same question, we give you a new variation that you've never seen. And as a result, there is no practice effect. So we tasted that. We tasted practice effect by administering BOCA every day, and there was no practice effect. We also compared BOCA administered on a computer and administered on a smartphone, and there was no difference. Our smartphone score was slightly better, maybe because people like their smartphones and they feel smarter when they're using smartphones. But basically, the screen size doesn't matter. BOCA uses auditory instructions, so it doesn't depend on the size of the screen. We also use very large buttons when we have to use buttons. And the typeface on the buttons is usually several times bigger than the typeface on the smartphone. So you shouldn't have any problems with seeing the question.
Good. So, of course, everybody wondering how can they take this test? So is this available to public for free? What's the process here?
Yes, absolutely. BOCA is available for free. You go to bocatest.org.
And BOCAtest.org. We'll make sure we'll put that in the YouTube comments so that everybody can have a link. Great.
There you fill out a short questionnaire before taking BOCA, and then you can take BOCA.
Wonderful. And I know you also have been quite interested in this whole domain of cognitive impairment and Alzheimer's for a long time, and you formed this company, LZ Life, and you do a lot more than just doing the cognitive assessment. So tell our listeners a little bit about other things you've been doing, and maybe just a little bit about what company does.
Absolutely. ALZ Life, ALZ Life, LIFE, is a company that develops an intervention. It's a unique intervention that uses 40 hertz gamma light and sound to stimulate activity in the neocortex. At the same time, we use games, cognitive games, that are placed on top of the light stimulation. So it looks very simple. It looks like a game. For you, it's a game. It's a game that you play on iPad. At this time, you need specific device. You need iPad Pro 2017 or newer, because only these devices can generate 40 hertz stimulation. Mm-hmm. And the games that we developed are unique games. They're all transparent. So there are line drawings, but behind the game is the light. So the screen is stimulating your neocortex, flickering screen. There is also sound that stimulates your auditory cortex, and they jumpstart your cortex into high focus, high concentration, and they help you to start a very important gamma rhythm. Mm-hmm. Gamma rhythm is essential for any cognitive process. Gamma rhythm is the frequency at which neurons synchronize in order for you to appreciate any object in front of you. That's the most important basic synchronization rhythm. In Alzheimer's disease and some other cognitive disorders, gamma rhythm energy decreases, and that is unfortunately has effect on not only cognition and memory, but also cleaning out of junk that brain generates every day.
The plaques and tangles, the classic.
Exactly. When we stimulate externally with 40 hertz light and sound, we restart this natural rhythm. Mm-hmm. The cortex clears out of the junk, and it goes into state where it can focus better, attention is better, and then you can use these cognitive games, which can be very simple, like very simple Sudoku and simple tic-tac-toe game, and there are even simpler games there. Mm-hmm. But the games go from simple to very challenging, and they can be very, very complex Sudoku and very complex checkers and other games. There are over 40 games there, and we constantly develop new games. These are memory games, attention games, word games, and many other types of games. You can play any games you like. You can play them at any time of the day you want. And we usually recommend 1 hour a day. And we are conducting studies, and preliminary studies show very good results. We haven't published any of our studies yet. For
full disclosure for our listeners, that one of the sites is actually GW, and myself as a PI of that study, we're involved trying to look at some of our patients. So sort of stay tuned. I think we're going to publish relatively soon. I hope we have a few more subjects we need to finish, and we'll get that published. But I think that's a sort of the future. I think the future of working with patients with cognitive impairments is this kind of complex programs that involve, of course, metabolic optimization, something like Bredesen program, but also, of course, all these other methods, including the 40 hertz light and sound therapy, and then, of course, with cognitive training, whatever that means for a patient. So I have a couple of practical questions. So one, patients often tell me how they really don't want to play games on a computer. So they just want to do something else. And, I always say, okay, well, it's always patient-centered care. So if you don't want to do it, fine. There are other ways to do it. So for patients who don't want to do that, I mean, how can they engage the 40 hertz light therapy?
There are other companies that are manufacturing 40 hertz light that you can install on a table and sit in front of it. I'm not aware of any studies of those 40 hertz lights. And
well, people can also still use the iPad with the light therapy, just without playing a game. They can just be using your app. They will put the iPad in front of them and they'll simply turn on the light source without necessarily playing something on it and just do other things, eat breakfast.
That is definitely an opportunity. Yeah, Life is a free application. You can download it at the App Store or at Google Store. Again, be careful about the device. The device must be compatible with 40 hertz stimulation. Most iPhones and most other smartphones are not because their refresh rate is too slow. So we recommend iPad Pro.
2017 or younger. Mm-hmm. I'll make sure we'll put that in the comments as well. Wonderful. Well, I think we'll have to have you back when we have more data coming out of your team. I'll make sure we also put the study, that BOCA study, also in the. Is it open access or
it's open access? Yes.
So we'll make sure I'll put the link to open access source for we have some very sophisticated patients who would want to read the whole study, and that would be wonderful. So thank you so much. Maybe kind of a last word of wisdom to our listeners.
Well, it is important to keep a good lifestyle with exercises and social communication. But these tools can increase your confidence, make sure that you are not falling behind. And it's all about being confident and being calm and doing everything you can.
Yeah, so I think that's actually a really important point. So we often underestimate the value of anything that will make the patient feel calmer and less stressed. Stress is one of the biggest destroyers of the brain, if you will. I mean, there are others, but it's one of the big ones. So I think getting any kind of even a very small advantage and actually can indeed send a pretty comforting and calming message to patients. And I think that's really important. Well, thank you so much. I'll make sure that, again, we'll keep in touch and we'll have you back in no time. Thank you very much. And everybody, thanks for listening. This is Dr. Misha Kogan podcast with Dr. Andrew Vyshedskiy, faculty from Boston University and the developer of ALZ Life, which is an online tool for all things cognition, including testing, but also computer gaming to enhance memory, as well as the 40 hertz light therapy and sound therapy. Stay safe. Bye.